Hello, my name is Alexander, and today we'll talk about the circulatory system. Two pathways come from the heart, the pulmonary circulation and systemic circulation. Pulmonary circulation is a short loop from the heart to the lungs and back. It has specific functions such as ventilation and gas exchange. It starts from the right ventricle and ends in the left atrium. The systemic circulation carries blood from the heart to all the other parts of the body and back again. It starts from the left ventricle and ends in the right atrium. Let's talk about the systemic circulation in details. Mitral valve opens and blood goes from the left atrium into the left ventricle. Left ventricle contracts and opens the aortic valve. So blood goes from the left ventricle into the aorta and into the organs and capillaries. And finally, from the superior and inferior vena cava, blood goes into the right atrium. Tricuspid valve opens and blood goes from the right atrium into the right ventricle. Right ventricle contracts and blood goes from the right ventricle into the pulmonary arteries and to the lungs. It's paradox, but into the pulmonary arteries flows venous blood, and into the pulmonary veins flows arterial blood. Blood flows through the arteries because of the high pressure that is generated by the contraction of the left ventricle. In the veins, blood primarily moves by the contraction of smooth muscle in the vessel wall and by the action of skeletal muscle as the body moves. One-way valves that veins have prevents blood from flowing backward. Also, during inspiration, when return increases at the thoracic cavity's pressure becomes more negative. Finally, we can say that pulmonary thromboembolism happens when the clot that is formed in the deep veins, usually in the leg, breaks off and travels to the lungs. During arterial thromboembolism, one can have the blood clot anywhere in the arteries, also in the left atrium or in the left ventricle. If this clot breaks loose, one can get cerebral or other organ infection.